I usually get hijama done just like on a maybe 4 or 5 month basis.
Especially this one, if you look at it, it's definitely gaining on the top.
Yeah, I think some people are squeamish, so they may not be able to watch, but education is important, man.
It's important, but it's not as entertaining because it's just a lot of facts. Look at that ring. Everyone see that? Look, it's bubbling a bit as well. That's bad.
So it's been 6 days now since my toe stubbing injury. I'll show you my toe. Okay, so let me just show you. Okay, so I've been given a boot. Yeah, hopefully you can see that there. Okay, but the NHS have given me this boot. Now, toe fractures can come about in 2 ways. A stubbing injury, okay, that's when you whack your toe, or a crushing injury. And again, it can happen in both ways. You can stub and crush. You must be very unlucky for that to happen. Mine was a crushing injury. So what happened was I dropped the barbell on it. I basically threw it down. You're wondering how that would have happened if there's weight on the side. There was no weight on it. I thought there was. I just chucked down, bang, hit me right there. All impact, high velocity. So it was basically 20 kg plus the force. Either way. Now, the advice is that I have to wear this boot for 4 to 6 weeks. Now that would take a large toll on my training because I have to incorporate running, and that's something that I can't do with a toe fracture. I want to find a way around conventional medicine. Again, I've got nothing against conventional medicine, but in a case where you've developed a fracture or a broken leg and there's very little that you can do other than what conventional medicine advises, which is rest and recovery. The reason why we might want to explore other options is because there are limiting factors to the speed of which your recovery develops, basically. So limiting factors include your age, your general well-being, your stress levels, your nutrition, the amount of rest that you get in, quality sleep. So these factors, again, they differ between person to person. Now I'm going to explore what we call an alternative medicine. So again, a sunnah called hijama, emphasis on the ha, meaning cupping. Now cupping can come in 2 ways, dry or wet. Like age-related macular degeneration can be dry or wet, but basically with cupping, the suction brings sort of blood flow to the area. Wet cupping will withdraw some of that blood from the surface level. Okay, but you're probably wondering how I can even cup this area. Again, this is why I'm going to leave it to the expert. So someone got in touch with me through my Instagram account. Again, if you have anything that you would like me to explore, particularly fitness related, you can contact me. Yeah, if there's a venture that you can contact me via @Manlikesanaan Reels. Can't contact on TikTok. I have an email address, but again, just contact me through there. I do respond to messages. If you have anything that you think is of benefit to me during my journey through the fitness game, as I'm a fitness coach. It wasn't quite so clear, guys, so I'll have to show you up close because for some reason, cinematic mode did not want to focus on my toe, but there we are. You can see the bruising. Assalamu alaikum, bro.
Walaikum Salaam. How are you, Sanaan?
Alhamdulillah, all good, all good. Just introduce yourself for people that don't know.
I'm already well known in Kamir, bro. Okay. My name is Mohammed Kareem. I know this guy from Dal Issa days, such a long time, honestly. So he's definitely a good friend of mine.
Good friend. No, thank you. Yeah. So basically, Muhammad, he messaged me. He saw that I had the toe injury, and I appreciate all the well wishes, but this guy came up with a solution. He said, I can give you some kind of alternative medicine, which is what hijama is around the area. Now, I usually get hijama done just like on a maybe 4 or 5 month basis, just to sort of aid my recovery I don't really have injuries. This is the first time I've had an injury, and you suggested that, I should do this, right?
Yeah, definitely. So what hijama is that it's an alternative medicine that's at least 3,000 years old. There's a lot of documentation. Hijama can spread from as far as China to Arabian lands, all the way to West and North Africa as well. And what it involves is you get suction cups that pull on the skin and it draws bad blood to the surface. And then by removing this detox blood, it adds fresh blood back to the surface and it improves healing. This is about a week after his injury. So normally you need that blood clot for injuries to prevent further bleeding, but a few days after, that's not really needed. So by removing that, he should get fresh blood. That's got the nutrients, so he heals quicker as well.
Okay, excellent. So what about, like, this is not a soft tissue injury, this is a bone injury. So does that make a difference?
Yeah, because all muscles are linked to bones as well. So even though I can't treat directly on the bone, if you treat what's surrounding it, it will improve circulation. Circulation is the key to healing. One quick thing I want to note, there's a reason why fingernails grow faster than toenails. Do you know why?
No, why is that? Is it better circulation?
Exactly. Okay, that's why fingernails grow better than your toenails.
Wow, didn't know that.
You didn't know that, yeah?
No.
That's why if you get better blood circulation, you naturally heal as well. As for this, everything is just clipped up, so we could definitely fix it. I find it interesting, right?
Interesting, you smashed it.
Yeah. Just like a general consultation, and then we get to the planning as well. Yeah, so top is just your general treatment plan, your general health assessment. Then we get into specialized assessments to know, because you got general injury, that's what I'm more excited, because I don't need to do specialized injuries. Everyone's just here for a detox or cures by hijama. And then we get to a treatment plan. Straight after your treatment, I suggest you try to get as much mobility back in your big toe as possible, because it's going to affect your squatting, and afterwards you're going to injure like your ankle, which you're starting to feel, and your knee. Because without the arch, your knee is going to cave in a bit more.
Yeah,
and that's where you get that pain.
Definitely. Okay, that's.
Does that make sense?
No, it does. It does. My coach didn't highlight these things.
Let me just do it. I got shoes on, so you put your hand away from a wall. Let's just say like this, and then see if your knees can touch the walls. Well, this test is dorsiflexion. If you've got a healthy amount of dorsiflexion, you should touch that. But let's say if I move further back, and then I can't reach it, that's my max. You can see my heel lifting off. Okay. I saw that with your squat, so that's a good test. So how we're gonna do it is we'll do your good foot first, then your bad foot, and then look at discrepancies. So it's best to do your healthy foot first. Just put your hand away from here. Okay. Yeah, or down. Yeah. So put your foot to as close to the wall, like one hand away. Yeah, that's fine. And then go on your knees for a squat when you can.
I find it difficult because this one I have to lift up a little bit.
Yeah, that's fine. Okay. Okay. So in terms of measurements, okay, that's fine.
I think I should be able to do this without.
Yeah, your knee doesn't touch. You want to get your knee to touch, and then we think. So yeah. Just about, we'll accept that. So keep your foot there, don't move it. So that's a discrepancy of about 2 centimeters. Okay. Okay, we'll move on to the treatment plan now, inshallah. Bismillah. So this is surgical spirit, definitely what they use in the hospital. These are the cups we're using.
Wow, where are they from?
Yeah. Al Huda. They don't sponsor me, bro.
Rate that, you killed it.
Yeah.
You should have told your supplier, man.
Bismillah, we'll do your good foot first. That's fine.
I got a video of the x-ray.
Bismillah, we'll do your good foot first. Just get the blood warmed up.
What about the sunnah? Yeah.
So basically the sunnah side is when Rasulullah Sallallahu Alaihi Wasallam, he came back from the Isra and Miraj on his journey down from the heavens. Every angel was saying to him, Alayka bi hijama, which means upon you is cupping. Now it's sticking. So he would regularly get it done. There we go, that's better. Is that okay? Yeah. Bismillah. Going slowly.
It's okay. Yeah, it's alright. Yeah, because
it should be tight but not painful. Is it painful?
It's alright.
Did you get it done in ICAT? What I'm going to have to do is I'm going to prop it up so the gravity doesn't pull the cup down, if that makes sense. Yeah, that's fine. Yeah, that one's good, that one's good. So why did Rasulullah Sallallahu Alaihi Wasallam get hijama when he got poisoned in Khaybar?
I would imagine to get the poison out.
Yeah. Because people back in the day, they would also suck poison out manually, but then it gets into their bloodstream. How does this one feel? Oh, that's fine. Bismillah. Say Bismillah. Bismillah. Okay, Bismillahirrahmanirrahim. Yep, your audience can see that fill up already. No way. You're ready. It's actually not too bad, right?
Nah, good. Alhamdulillah. And that was a gentle scratch.
So Bismillah, not too bad, right?
No, Alhamdulillah, not too bad.
13, 14, 15. Okay.
Just so they know. That's okay.
Had to. Okay, let's do one on your bad foot. This is your very bad foot.
Okay, Bismillah.
Bismillah. This is the one we want to think.
I'm a bit nervous about this one.
I'm nervous as well, but we'll be fine, inshallah. If you trust me, it's fine.
Trust in Allah.
Best trust. How does your bad foot feel like? Especially this one, if you look at it, it's definitely gaining on the top.
Feels alright. It just feels like it's been cupped. There's no pain, as in like, there's just necessary discomfort that I'm experiencing. Thank God you took that off, bro.
Yeah, it's off.
Alhamdulillah. That was the only one that was a bit uncomfortable for me.
This is the bad one that's been annoying Sanaan. Look how much is collected from that small bit here.
Crazy.
Allah.
Bismillah.
Bismillah. That's the bad one. Can I scoop it? Yes, I can.
Yeah, I think some people are squeamish, so they may not be able to watch, but...
You might want to put that as a sign on your thing.
What's that?
Not for the faint of heart.
Yeah.
But you lose a lot of gains afterwards as well.
Whoa, let's not say that.
Yeah, I know. But I know athletes that do.
Yeah, definitely stops your cardio health, because there's no alternative to running, really.
Yeah, that's correct. See this one? Like pure jelly, this one.
Is that better?
Yeah, look.
That's what it should look like.
Yeah. Okay. So to your viewers, why it looks like this jelly, I'll explain another time. Big cups, best for the knees. Okay. And hopefully, if your viewers are not too squeamish, they can see it pile up live at a good angle.
I don't want it to pile up, to be honest, myself. Damn, man.
There we go. Okay? Yeah, I see the reaction on your face. It's funny.
You like the pain, yeah?
Bismillah. I just say Bismillah every time I cut.
Is that what was taught to you?
Yeah. What I like about the knees and the upper body is
Yeah.
it just cuts much easier compared to like the foot. Because
Yeah.
it's too much skin and not enough blood circulation there. So this one, as you can see for yourself live. And it's just easier angle. Like I don't have to go on my knees. There we go.
Not sure if they can see that.
You'll see the rest.
Bring that thing there so they can see it from that perspective. Or?
Yeah, no problem. No, just keep that there. Bismillah. 1, 2, 3, 4. Okay. Look at that filling up now.
Yeah. People do like alternative medicines because they know the NHS. This one wrecked. That's nice.
How does your bad foot feel now that I've done that?
Yeah, it feels right. The thing is, when it's all, I don't know, I'm a bit weird when it comes to like discomfort. If I've got like discomfort in a particular area, I forget about the most painful one and I just, the whole leg is sore. I don't know if that makes any sense. No, I do anything to speed up the recovery, man.
You can see the bubbles on that one.
Oh, so you got a sink here.
Yeah.
Fair play.
Too tight was okay.
It's just a bit close to the bone, that's it. I just think.
To the bone is fine because that's your cartilage. It doesn't get enough blood flow here. That's fine. Just you're gonna have to tolerate. Breathe. I always tell my patients take deep breaths. It helps. Trust me.
Okay, good idea actually, yeah.
No, if you breathe, it helps you tolerate pain better. Let's get the left hand side removed now.
Excellent.
Do they do clinical tests in other ones as well or no?
Yeah, well, it depends, isn't it? If I'm upper body, they'll check mobility.
Do you see that for your viewers? See that jelly part? Like upper body, you definitely get a lot of jelly ones.
Yeah.
When I did it for my head, let me just skip this one.
Yeah.
To collect. Oh, look at that.
No, I mean, like, do you like seeing jelly? Is there anything you'd like to see when you do cupping?
Yeah, because this is the effect you want. You want to remove this jelly-like substance. Just go to my YouTube channel, I'll explain.
I will. What is
I'm
yours?
not as, it's under the same name, but I'm not as interesting as you.
No,
I'm kind of boring.
No, this is what you need, man.
Yeah, I'm more of an educational thing, and people know education is boring.
Education is important, man.
It's important, but it's like it's not as entertaining because it's just a lot of facts.
Yeah. But this is no joke, man. Look, I'm bleeding. I've been suction cupped. Like, this is not a joke. This is something I take seriously.
See that?
Look at that. Nowadays, obviously, with inflation and everything else, nothing is more important than your health. You'll realize that. As I said, you know, I've been more active before the injury, and now I can't do that activity. There's stuff that I didn't like to do, but I had to do, which is running and cardio. But now I'm not doing that. I almost miss it, if that makes sense.
Look at that ring. Everyone see that? Look, it's bubbling a bit as well. That's bad. This is your souvenir. Normally I don't use it in a cup, but it's just for the viewers to see.
Yeah.
Have you cleaned up in a minute as well? Oh, look at that, man.
Wow. Some stagnant blood.
Yeah. And that's on your bad leg, right? Yeah.
If they appreciate that, they should mention in the comments below.
Yeah, you can follow me on my Insta as well.
Yeah.
Let me just get you cleaned up, bro,
calm.
before we
I'll
go.
put his Instagram in the description. Definitely get yourself booked in.
How you feeling? Do you want to check your ankles quickly?
Yeah, we'll check them. Okay, so we're gonna just retest the, what'd you say, dorsiflexion?
Yeah.
I'll just test with my good one first.
Yeah. Always go good to bad, then you will see how much your dorsiflexion is. So your knee has to touch the thing.
Just make it touch.
Just about touch. That just about touches. Okay, that's your pen. Then let's do your bad one now. Move a bit more back, yeah.
Decent.
Yeah, decent. So move back, so about there. I think we got before and after of the video, right? There was a big discrepancy. I would say it was this much before.
Yeah.
Like 2 centimeters, but now it's like half a centimeter. Do you feel a difference?
No, I do, genuinely.
Generally.
Feel good. Alhamdulillah, I feel a lot better, but only time will tell, isn't it? So, Insha Allah, again, I'll be back again in about 3 months' time, you said, yeah?
Yeah, 3 months.
3 months, bi'idhnillah ta'ala. But yeah, genuinely, alternative medicines, especially in line with Quran and Sunnah, are going to be the best ones for you. So, thank you very much for watching.
Subscribe to Manlikesanaan.